Welcome to our Udacity Thought Leadership Series. I have two amazingly interesting gentlemen with me today. Kerrie Holley is Chief Technologist at Optum, former CTO at Cisco, and just one of the wisest people in healthcare today. And next to him, my good friend Toby Cosgrove, former head of the Cleveland Clinic, a world-renowned heart surgeon, and one of the wisest men I've met when it comes to healthcare. So welcome on the show today.
Pleasure to be here.
Yes, absolute pleasure.
You'll be talking to our students in the world who care about the future of the world. And you're also talking to our commercial partners who will admire you for what you've accomplished and we want to learn from you how healthcare will develop. And let me start with you. You've worked as CTO before at big companies. You worked at IBM, you worked at Cisco, and then got drawn into this, what is actually, I think, the largest healthcare company in the United States today, Optum?
Yes.
The largest that people haven't heard about before?
Yes. United Health Group. You know, we have these two platforms, UHC around benefits and Optum around healthcare services.
So you're sitting here now and you live in Silicon Valley and you see the clash of the Googles and the Facebooks who want to change the world overnight. And then you also have experience with a system that's, 18% of the GDP in the United States. Tell us about the intersection. Like, if you're young and want to change healthcare, how do you go about this?
That's a great question. I think that there's many opportunities to change healthcare. I think you can do it by being part of the healthcare system. Mm-hmm. You can do it by being part of a technology company like Google, Amazon, Facebook. You can do it in academia by being with schools like Stanford or CMU. And more specifically, I think you can do it, as you probably can imagine, that I'm going to say with artificial intelligence. I think that not artificial intelligence alone, but if you look at all of the intersecting technologies, there's a tremendous opportunity to improve our healthcare system.
What is the low-hanging fruit? Like, say you want to start a startup company in AI, what would you do in the medical space?
Oh, this is a great opportunity. I mean, there's a ton of startups already in the diagnostics. There's a lot in the clinical. I think the greater opportunity is around ambient computing and the opportunity to do better in terms of home care, to do better with aging at home. I think there's a tremendous underserved opportunity there to use just a variety of technologies and Internet of Things, artificial intelligence, edge computing, just a ton of opportunity in that space.
Toby, I kind of want to ask you the same question because you've ran the best clinic in the world. I mean, there's many of those, but the Cleveland Clinic obviously you opened a branch in Abu Dhabi as an insider expert. And now, after your retirement and moving over to the foundation, you've also spent some time here in Silicon Valley. What have you learned?
Well, first of all, one of the reasons I'm here in Silicon Valley is because I recognize the enormous opportunity that Silicon Valley and tech companies bring to healthcare. One of the problems in healthcare right now is we're swimming in data. We had just a couple of examples. The total amount of data in healthcare now doubles every 73 days. There are 5,300 medical journals putting out over 800,000 articles a year. There's more information than anybody can possibly handle. That's the problem. And we need to store it someplace. We need to have access to it, and we need to make that access interoperable. Now, so the bad news is we're swimming in data. The good news is we're swimming in data because this gives us an opportunity to begin to analyze that data and to have new realizations, which I think ultimately will make care more affordable. I think it will improve the quality of care and make us more efficient as we go about this.
Let me follow-up question. Obviously, privacy is an incredibly important concept, specifically in health and human services.
Yes.
More than any other field. At the same time, I've heard people say, look, if we just took all that data and somehow put it into a machine and do machine learning on it, we might find new forms of treatment, new forms of diagnostics, of therapeutics that would benefit people and make them live longer. How can we balance this trade-off in society?
Yeah, well, so here's a great example. Optum, for example, has 1 million patients have a diagnosis called aortic stenosis. That's a narrowing of the main valve that comes out of the heart. They know how they've been treated, they know the cost of how they've been treated, and they know how they've done well. If we take that incredible series, it's going to change how we begin to think about the indications for intervening in somebody with that particular disease process. that can all be done by de-identifying the information. And I think the security is clearly better in the cloud than it is in our individual facilities.
It's an important statement for anybody to hear. The security is better in the cloud than individual facilities.
Yeah,
I completely agree with this.
What is our expertise, frankly, at the Cleveland Clinic in running a data center? I mean, we're clinicians. We're not data experts, and I think we're much better to move all that information to the cloud for security purposes.
Well, luckily we have a person from Optum here, Kerrie. Let me toss this to you. What are you guys doing about this?
Well, I think that what the doctor said is correct in several regards. One is that de-identified data allows you to deal with the privacy issue, but I don't think we should conflate privacy and security, distinctly different issues. So in terms of security, absolutely correct again. In many cases, the security is better in the cloud. But there are opportunities, or rather I should say necessities, to have data on-prem. Some of those necessities are because of geographical differences in laws that dictate, that mandate. Some of those are because of privacy, and some of those are because of the latency, the fact that we actually have to do some things at the home, we have to do some things in an urgent care center, so we have to be able to bring the computing to where the problem is, where the data is. So this is a more complex issue, but totally agree, but I think there's a hybrid opportunity here that we absolutely should use the cloud, but we should recognize that we have enormous data, and all of it isn't going to live in the cloud for a variety of reasons.
Kerrie, we talked briefly about, we have a joint acquaintance, a friend called Vinod Khosla.
Yes.
He famously once said, don't go to medical school.
Yes.
Do you agree?
Absolutely not. Well, you could say I'm biased because my son plans to go to medical school, but I do think that that the technology, and particularly artificial intelligence, will allow doctors to do more, not less. So I think we will still need doctors. I think, maybe in 100 years or 1,000 years we won't need doctors, but it's not in our lifetimes. We need their Robert Watcher, who wrote the book Digital Doctor. I know he had a real good conversation with Vinod, but he said something that when I met with him that was very pertinent, which is that I don't know if you agree, doctor, but looking at a patient, there's things that you observe that maybe we won't be able to observe with a machine. And I know we can get a lot of signals from, we can detect depression, we can detect moods, effective computing. But at the same time, I'm still of the mindset, not just because of where we are presently with technology, that doctors do things that we aren't going to be able to do with machines.
Let me push on this. There's a recent result that in brain scans, machines can find Alzheimer 8 years earlier than the best human physicians. There have been results that an iPhone can detect skin cancer more accurately than most human physicians. Why not the thing you're talking about?
Yeah, I think that's great, but that's the same of every technology has improved what doctors do. So they have stethoscopes today, and you can speak to these issues better than I, but the point I'm making is that, and that's why I say they'll move to higher ground. They'll do more clinician services. They'll do more research. I don't know the specifics, but I don't think it's a replacement of doctors. I think it's an augmentation.
I would clearly agree with that. I mean, I've never seen a AI stop bleeding.
I like that. It's a great point.
That's probably true.
I'm going to quote you on that if you don't mind.
Toby, you wrote a really great book that I recently read and really enjoyed, and you make some really insightful points about how to organize a hospital, whether to give people a fixed salary or pay them per service and so on. I think Cleveland Clinic is also famous for having every person reapply for the job every year. You're very well known for random drug tests among your doctors. Tell us about your feel on how to organize a large organization, and how do you bring the nimbleness and humbleness into something that's big?
Well, it's interesting. When I started as CEO, I asked myself the question, why are we here? Why do we get paid? Why do we have a clinic? Why do we have a hospital? Why do all these people have a job? And there's only one reason. It's for patients. So we started out with that being our mantra, patients first, and then everybody realized that their satisfaction was first and foremost, and what we did. And then we reorganized. Most hospitals are organized around the guild system of surgeons and medical doctors and pediatricians, et cetera. We organized it around patients' problems. We said, okay, the neurologists and the neurosurgeons and the psychiatrists all ought to be in the neurologic institute. And The cardiac surgeons and cardiologists and vascular surgeons, vascular medicine, all ought to be in Heart and Vascular Institute. So we organized around patients' problems, and as far as I know, we're sort of the first group to do that. And I think if we understand that the reason that we have these facilities is really around taking care of patients, we'll be better off and more efficient. Back to your point about how we pay doctors. We essentially have one-year contracts. We all have straight salaries with no bonuses. And interestingly, what happens is that I now, as a surgeon, a heart surgeon, could tell people, look, you need a heart operation. It's not going to make any difference for my back pocket. And one of the interesting things that happened is the Dartmouth Atlas about 20 years ago did a study of the cost of the last 18 months of life for patients who are Medicare patients. And the two institutions that had the lowest cost were Mayo Clinic and Cleveland Clinic, both of which have doctors salaried.
Yes.
And so there's no incentive for us to do more, no incentive to do less. So that, I think, is a great stimulus to do the right thing.
Is this something that the nation should adopt? Should we move away from fees for services?
Yeah, well, I think we're paying people the wrong way. I think ultimately we have to pay people to stay healthy, because the majority of our costs right now are chronic diseases, and we can't affect those chronic diseases by taking care of people earlier on, keeping them out of the hospital, helping them stop smoking, helping them keep their weight under control, deal with this massive problem that we have with the opioid crisis, which those three factors have wound up decreasing the life expectancy of Americans over the last 2 years, which is really shocking when you stop and think about it. But now, for example, 40% of the people in the United States are obese, which leads to
all problems.
All problems, all kinds of problems.
Boy, Cleveland Clinic, 3,600 doctors, Optum, 40,000 doctors. So you must have the same problem on steroids. How do you incentivize people to do the right thing in the medical field?
Well, I think what the doctor said is spot on. We've got to find a way to get people to be more engaged with their health. Just as they're engaged with their health fitness tools or their entertainment or their social platform of choice, we've got to find a way to get that same engagement with health. And he's also right. We've got to focus on outcomes. We've got to it's not so much an issue of pay for services or fee for services as how do we get the outcomes that we desire, which is to help people live healthier lives.
And by the way, let me just add on top of that, I think that radical transparency is important. We are transparent both internally and externally. Externally, we publish outcomes for every one of our specialties on an annual basis. Internally, we post doctors' scores by name and rank order. And it's a very powerful tool.
I imagine. So your incentivization is not the more services you provide, the more money you make. Your incentivization is you get fixed money, but you get recognition. And come the year when you reapply for it, yes, you reapply for your job every year. Is that correct? As a CEO?
That's right. I've had 44 one-year contracts.
Wow.
Would you recommend other companies to follow the same model, and like even my company, that people would apply every year?
I think most, we have annual reviews too. We take it very seriously, and I think that, and frankly, I think tenure is a invention of the devil. Many people.
I had it. And I gave it up.
Good idea, but I think it tends to not bring out the best in people, and I think that it would be actually reviewed every year. Your salary is adjusted according to how well you do. It can go up, it can go down, it stay the same. But those are important factors in motivating people to do the right thing.
Cleveland Clinic is famous for, I think, innovation in innovation per se, and also in education. You've done a lot of work in education. What are your thoughts? How should the future of education look like in the medical space?
Well, I'm really excited about education. I think it's going to change enormously. And one of the things that we recognize now is that healthcare is not an individual doctor. It's a team of people, a huge team of people. And so what we've done is we've put together a new health education campus that's bringing together medical students, nursing students, dental students, and physician's assistants, all to learn how to play team ball right from the get-go. And we are also employing the new technologies. For example, augmented reality, HoloLens. We're now teaching anatomy without a cadaver. I have to tell you this story because the other day I'm walking around a heart that's out in space, and you walk all the way around it. And they say, Toby, stick your head in. So I go like this. My head's inside the heart looking out, a view that in 40 years as a heart surgeon I'd never seen before.
That must have been fascinating.
And so we don't have cadavers anymore. And so just think what that means in terms of education. And, you know, I think MOOCs are going to be an important part of how we educate going forward. Why should a professor of organic chemistry or biochemistry have to teach a bunch of medical students the same damn thing year after year after year after year after year after year? I mean, you do a great job teaching it once, record it, and let them learn it at their own rate, at their own speed, and let that professor get back into the lab where he wants to be.
Yeah, I think I know a company that does something like this in the tech space. I forgot the name. Started with an U.
Yeah, I
Udacity?
can't remember.
Yeah, correct. I would say many thousands of our viewers are young, eager people who've just specialized in AI or data science and are burning to make a positive impact on the world. What's a good path in? Like what, from the graduation of, say, another degree to becoming an influential person in the industry, what path can a young person do?
Well, I think if I were a young technologist just coming out of the university, computer science major, we're a big fan of the Udacity courseware. That's what we use to train, but it's not enough. It's essential, but we also need these full stack engineers. So I would encourage people not to equate data science to artificial intelligence. One is a tool of the other. And so that would be number one. Become a full stack software engineer, you know, containers, DevOps, cloud, agile, boom, boom, boom.
Wow.
And this is going to be a sea change for a lot of technologists. Some won't be able to make the change to deep learning. And we're going to go beyond deep learning. There's going to be more if you read Daniel Pearl's book on the Book of Why. So when you look at causation, which is where we're going. So my point is that there's a new skill set, but you got to know the math, you've got to know the tools of machine learning, and you got to know the full stack engineering. So that would be one thing. I would say the industry, whatever industry you choose to work in, know it well. Become a domain expert. That's going to do you well as well. And then you need these soft skills, the ability to lead, the ability to persuade, the ability to collaborate. So that's where I would start if I were a young professional.
I think we have to brush up on our end on the soft skills. We're not doing a good job at Udacity yet, but it's on our list right now.
Yes.
So you've employed a good number of computer scientists, and you got some really, really good people. I remember when I was a student, I studied medical informatics, and I didn't enter the field, in part because all my friends told me, as a computer scientist in a hospital, you're a second-class citizen. There's the doctors and there's the other people. You overcame this?
Well, you know, we think that everybody on the team is part of, we call them all caregivers. And so whether you drive a bus or you're a neurosurgeon, you're all part of a team. And I think that the data scientists are an essential part of the team now.
So you think the future of education should bring medical people and data scientists and bus drivers together into one classroom to really figure out how to do patient first?
Well, that's what we're trying to do. We're trying to incorporate everybody and part of the system because, you know, without supply chain, for example, we couldn't do neurosurgery. And without the data scientists, we're not going to be able to keep track of the data and organize it and have it useful to us. So we're all part of the team. We're all pushing in the same direction, but we're doing different parts of it.
I love what you're doing. You opened a hospital in the Middle East.
I did.
In Abu Dhabi. How did it come along? What happened? What did you learn?
It's an amazing facility. It's now a 22-story high building. We have 5,000 Cleveland Clinic caregivers there from all over the world. Wow. We had 12,000 doctors apply for privileges. We hired 350 of them, so they are first-class individuals. We've now been up and running for about 3 years. It's growing at the rate of about 30% a year of patients. And it's been enormously successful. We're now doing heart, lung, kidney, and liver transplants, and with the same results we got in Cleveland.
That's very impressive.
That is impressive.
It was a long, hard slug, I'll tell you.
I love what you're doing for the region because I think the more diversified the region will be, the better for the region. That's really a huge step forward.
That's an interesting aspect because healthcare is one of those things that is an enormous diplomatic tool. I mean, nobody really cares, what country you're from or what you believe if you come and take care of them. And it creates a tremendous amount of goodwill. And I've talked to the State Department about that on multiple occasions. It's a great opportunity for the United States to spread one of its most attractive assets, and that's healthcare.
And it takes really the groundwork to actually do it, not just say it. So you've done it.
It's a big effort.
Well, Optum, if you believe Wikipedia, operates in more than 20 countries, including Brazil and the UK. Tell us more about the international engagement and what you find.
That's a great question. I don't know as much about our international operations. I know that we did some acquisitions in Brazil, and we see a tremendous opportunity not only to make that healthcare system and clinical care better, but also an opportunity to learn and to be able to maybe in the future take those learnings and extend that as we've seen in the Middle East or other parts of the world. The UK, we've done some work around genomics with the project called GEL, which has been a tremendous learning for us as we move more aggressively to use genomics as part of our full equation of acquiring data to help people be more healthy and to be able to do more preventive and intervention types of services.
If some ghost in the bottle, Kerrie, that's my last question, gave you a free wish for healthcare, something that you believe would transform everything, what wish would you have?
That's a great question. I don't know if the doctor agrees with me, but I that wish would be that all of us had a digital twin that we could take out of our pocket, or we could use it on from a laptop, but it would know everything about us. It would know and have all of not just our data, but it would be able to look ahead and say, at the rate you're going of weight gain, these are the likely conditions, or we're seeing, it would have all the medical journal knowledge. It would be able to really be a twin that I could engage with, dialogue with, and really help me live healthier, tell me where I'm going to see bumps in the road. That would be my wish.
I would love this. I think if you look at the tea leaves today, like from sleep devices to fitness devices to nutritional apps, it seems to be going at least a step in that direction right now.
Oh, absolutely, absolutely.
So you want to go all the way to the end?
I want to go all the way.
Okay. Toby, on your end.
And by the way, be a tool for doctors, not a replacement. Be a clinician tool, not a replacement.
Yeah, I think we have to look at technology as going to be as a tremendous aid to healthcare providers and also to patients. And clearly the emphasis in the United States has got to move, or across the world, has got to move from sick care to healthcare. We've got to keep people healthier, and they have to understand their part in it, and we have to help educate them.
It's interesting. It seems we have almost no data on healthy people. Almost all the studies start with sick people. Is that correct?
That's correct. And if you stop and think about it, say in 1950, what we were dealing with was trauma and acquired diseases, gallbladders and hernias and infections and all that sort of stuff. And gradually what we've done is we don't have the acute diseases anymore. We're spending most of our time dealing with chronic diseases. And the chronic diseases ultimately are generally a result of how we live.
Behavior.
Behavior change is one of the hardest things to induce.
I agree.
It seems. In fact, from the statistics you quoted about both opioid crisis and obesity, it seems to be going the wrong direction. So you would love to revert this. What can technologists do to revert this? I mean, there's fitness apps, but there's a recent study in the New York Times that says there's various sleep tools. They can tell you how to sleep, but they don't help you sleep better.
Right. Well, I think that's that's the real challenge, is to begin to use the technology to begin to change people's behavior. That's really hard. And I think one of the things we're going to see that's going to make an enormous difference is telehealth. Reaching out to people in their homes, reaching out to keeping them out of the hospital, keeping them out of the emergency room, thinking about mental health. I mean, many people would rather talk to a computer than talk to a person about their most intimate details of their lives. And so that has an opportunity to expand. Our telehealth business is just going like this. Right now, Kaiser's only sees 50% of their visits in person.
Wow.
So the potential for this is, as you know, from dermatology to psychiatry to any number of things is absolutely enormous.
I think we can learn a lot from social media. They actually have changed behavior. So the way we engage, the way we entertain, and there's a science to what they're doing. And I think technology actually can influence behavior. We just aren't there in the healthcare field. But I think that's one industry
It's a good point. I mean,
we
if
can
you
learn
look
a
at
lot from.
something like Strava, which is a social network biking and running app.
Yeah.
I've seen people who bike faster because they're competitive and want to be the
Exactly.
first.
Exactly.
Wonder if we can do the same with nutrition and exercise.
Exactly.
That'd be great.
Well, there's lots of activities trying to do that
Yeah,
Yeah.
for distance coaching.
good. Well, Kerrie and Toby, I think we're out of time at this point. It's been an enormous privilege to have been able to spend time with both of you. You're both extremely accomplished and really good friends. I hope everyone in the world will enjoy this. I would take from this debate that we're just at the beginning of healthcare in the history. I think 200 years ago, we had no general anesthetics, we had no penicillin, we had bloodletting. Now we're just entering the stage where training physicians don't require cadaver anymore. They can do better in simulation. But if you read from this debate the possibilities that come through data in healthcare, and think of yourself what's going to happen 50 years from now when you have a digital clone, when
Yes.
diagnostics is pervasive, when you find cancer when it's small, no matter where it is. I think there's amazing opportunities to make an impact. And thanks for sharing all your wisdom as two of the most senior and most experienced leaders in the field.
Well, thank you for
Kerrie.
having us.